It's a normal evening. You're relaxing at home, maybe watching TV, when suddenly something feels off. Your left arm doesn't respond. You try to speak and your words come out slurred. You realize something is very wrong. This is not a minor issue. It's a stroke, also called a cerebrovascular accident or CVA, a medical emergency that affects thousands every day in the US and Canada. Every minute matters because every minute, millions of neurons in your brain die. Stroke is the second leading cause of death worldwide and the leading cause of adult disability. Knowing what to do can literally save a life. In this video, we're going to break down everything you need to know: what happens inside the brain during a stroke, the early warning signs, and the life-saving steps you must take immediately. By understanding the causes and recognizing symptoms, you can protect yourself and your loved ones. Make sure to subscribe and turn on the bell so you don't miss critical health information. And tell me in the comments, have you or someone you know experienced a stroke? Where are you watching from? Your story matters. Let's start with what's happening inside the brain. There are two main types of stroke you must remember: ischemic stroke, which makes up about 85% of cases, and hemorrhagic stroke, which accounts for around 15%, but can be deadlier. An ischemic stroke occurs when a blood clot blocks an artery in the brain. Oxygen and nutrients stop reaching brain tissue, and cells begin dying within minutes. Hemorrhagic stroke happens when a blood vessel ruptures, causing bleeding that puts immense pressure on surrounding brain tissue. Regardless of the type, the rule is simple: time is brain. Neurons only survive a few minutes without oxygen. This is why early recognition is critical. The B-FAST test is a simple, effective way to identify stroke symptoms. B for balance, sudden loss of coordination, unsteady walking, or dizziness. E for eyes, sudden vision changes, blurred or double vision or partial blindness. F for face, ask the person to smile. One side may droop. A for arms, ask them to raise both arms. One may drift downward. S for speech, listen for slurred or strange speech, difficulty finding words. T for time, call emergency services immediately. In the US, dial 911. In Europe, 111. Anywhere else, get to the nearest hospital as fast as possible. Now, let's explore the two major treatments that can save brain function if administered promptly: thrombolysis and mechanical thrombectomy. Thrombolysis, sometimes called the chemical clogger, is a treatment where a clot-dissolving drug is injected into the bloodstream. This treatment is only effective within 4.5 hours of the stroke onset, which is why immediate recognition is crucial. Once administered, the clot dissolves, restoring blood flow to deprived brain regions and saving neurons from permanent damage. Mechanical thrombectomy is a newer, revolutionary procedure for cases where the stroke onset is unknown or the clot is too large for thrombolysis. A small catheter is inserted through the femoral artery in the leg and guided to the brain. Using a tiny mesh device, the clot is captured and removed. Restoring circulation, this procedure can save lives and significantly reduce long-term disability up to 24 hours after stroke onset in selected cases. But all of this technology depends on one thing: you noticing the early warning signs. Recognizing a drooping face, a weak arm, or slurred speech and acting immediately is the first step in saving brain function. Delays in calling for help dramatically reduce the effectiveness of life-saving treatments. Let's talk about what can happen if a stroke is ignored. The longer brain tissue is deprived of oxygen, the more neurons die. Early signs like dizziness, mild weakness, or facial droop can progress to full paralysis, severe speech impairment, and permanent disability. Recovery becomes longer, harder, and sometimes incomplete. Stroke is a race against time, and your awareness can make the difference between full recovery and lifelong disability. Preventing stroke is just as important as early recognition. Risk factors include high blood pressure, diabetes, high cholesterol, smoking, obesity, and a sedentary lifestyle. Maintaining a healthy diet, exercising regularly, controlling blood pressure, and managing stress can all reduce your risk. Additionally, regular checkups and cardiovascular assessments are essential, especially for those over 50 or with a family history of stroke. Remember, stroke can happen suddenly, even when someone appears healthy. That's why awareness, prevention, and rapid action are critical. Share this knowledge with family, friends, and coworkers. Being prepared could save someone you love. If you found this video helpful, make sure to subscribe for more life-saving health tips. Share your experience in the comments. Have you or anyone you know experienced a stroke? Where are you watching from? Your story matters. To summarize, strokes are medical emergencies where time truly is brain. Early recognition using the BFAST method, immediate emergency response, and understanding modern treatments like thrombolysis and mechanical thrombectomy can save lives and prevent permanent brain damage. Prevention through healthy lifestyle choices and routine checkups are equally vital. Your awareness and quick action are your most powerful tools in protecting yourself and those you love. Stay informed, stay vigilant, and remember, every minute counts.